Thank you for having me, and thanks everybody for being here. My name is Max Merkow. I'm a neurosurgeon in Walnut Creek. I treat patients throughout Contra Costa County, and I enjoy taking care of patients with brain tumors and want to tell you a little bit about that tonight. As many of you know firsthand, a lot goes into taking care of a patient with a brain tumor, and as Margaret said, you know, a support system, be it your family or a sort of more organized and well-established system like the cancer support community is a big part of that treatment. In thinking about the talk tonight, I didn't want to make it too discombobulated, so I decided to focus on something called laser interstitial thermal ablation. There's a few different acronyms and way of describing it, but as I walk through my slides, you'll see that the idea is that this is a treatment where we can use a laser catheter that emits photons or light to heat up the tissue that is a brain tumor and to essentially burn the brain tumor. There's various reasons why you would want to use that and various reasons why you wouldn't want to use that, which again I'll try to highlight over the next few minutes. I guess with that, saying that, I'll sort of move ahead. One of the things I wanted to start with, which I've alluded to already, is that there are a huge number of tools that go into treating a brain tumor or a patient with a brain tumor. And as my colleagues here know, I mean, we see each other all the time in a brain tumor conference where we every week go over, well, you know, maybe we need to use radiation, maybe we need to use this medicine, a different medicine, maybe surgery is necessary, surgery to remove the tumor or surgery to just biopsy the tumor. And it is one of these sort of genuine multimodality requirements and situations that isn't purely medical, purely surgical, or purely radiation-based. And again, as I said before, a lot happens outside of the hospital and outside of the medical office. So this is an example of a patient's MRI with a brain tumor. And what you see is a large cystic tumor. You know, even to the lay eye, most people can recognize that there's an abnormality, this sort of white area, or the black area that's encircled in white. And I bring it up just to sort of, as a starting point of going through, I don't know what I list here, 10 of 30 different types of therapies or therapies that could go into this person's care. So this is me taking out a brain tumor in the operating room. That's one potential therapy. There are innumerable medicines now, and you'll hear about some more of those, I think, when Dr. Chen talks, but traditional chemotherapies, small molecule inhibitors, immunotherapies that are sort of part and parcel of treating a patient with a brain tumor. Radiation is a very common technique that we use, and here's one device that is called the True Beam, which is a relatively versatile device that delivers radiation in a controlled way to brain tumors and you know, for some patients with other problems. Optune, some people here know about the Optune, which is a device that runs electrical fields over the scalp as a way of treating brain tumors, most commonly brain tumors that arise from brain cells themselves. This is an image of a laser catheter. Again, this is sort of the focus of the talk today, but this black line is the laser going through the brain tissue, and in this case the tumor is in the temporal area. And I also listed, again, this is a sort of inadequate list if you were trying to be comprehensive, but this last picture is a picture of not really a treatment tool, but a diagnostic tool, one that's close to my heart because I'm a surgeon and thinking about anatomy a lot, but this just shows the wires, the fiber tracks, the tracks that connect the parts of the brain that we use to control, in this case, our leg, to our leg, and all the wires between, so that we can avoid them with surgery. So the main point of this slide is that when I'm thinking about a patient with a brain tumor, when my colleagues are thinking about a patient with a brain tumor, a lot is running through our mind in terms of what needs to happen to sort of maximize, as I like to think, quality and quantity of life. And not having been there myself in the position of having personally having a brain tumor, I think it's probably a bit more sort of bewildering from a patient's perspective, but the same thing is running through his or her mind. So I tend to like to use examples in individual patients as just sort of a way of thinking about a problem. And the example I'm using today is a 55-year-old man who had a history of melanoma on his skin. And he had undergone whole brain radiation. He'd undergone chemotherapy and had undergone focused radiation as well. So there were 2 radiation treatments. This was a couple of years after diagnosis of a brain tumor, of a metastasis to the brain, and he presented with worsening right-sided weakness. So, when I'm with my colleagues and we're thinking about a patient like this, I think I have a scan next. This is his brain scan. And what we see is a known metastasis to the brain that has already undergone at least 3 treatments, the medicine, chemotherapy, as well as 2 forms of radiation treatment. In this sort of situation, we're very reticent, we're very reluctant to give more radiation because the more radiation you give, and as it accumulates over time, there's a higher likelihood of injuring normal brain tissue and causing a sort of bad, vicious cycle that leads to more swelling. We often refer to that as radiation necrosis. So this is where, this is one example of where this laser tool comes into play, because we're looking for a focal therapy directed at this brain lesion, this melanoma metastasis that hasn't, or that although did respond, the response wasn't durable. So let me just sort of introduce the idea of what this laser catheter is, because I'm sure everybody's like, well, what is he talking about? So here's a movie, a cartoon, again, just to give you a little sense of what goes on in the operating room as I put the catheter into the exact spot I want to, and then burn the tumor, and then care for the patient afterwards. But again, it's just a very short video to illustrate that. In this case, right sort of skewering the brain tumor, and then you see that it lights up, it heats up, it burns the tissue, and then we can pull it back along the length of the tumor. And if I go back here, you see here too, in this case, there's a frame that you can see depicted, and if nothing else, I just wanted to convey the point that it's a very focused treatment, that we oftentimes are generating a 3-dimensional coordinate system that includes the patient's brain so that we get that exact right trajectory through whatever lesion, in most cases brain tumor, that we're treating. So this is what the catheter looks like, and there's a few components. One is there's this cooling system, and so simply what we do through that is run cold saline solution, cold salt water. And then this is the catheter that goes into the brain and then into the tumor, and then within that catheter, within that tube, we put the sort of laser emitting element of the system. And so you can see that it's sort of this cooling system around a hot tip, and the idea is to create a sort of a very focal area, a very small area that's heating up. See what I have next. So this is just sort of a busy slide to depict what I'm looking at during the treatment. And I sort of have a slide at the end of the talk about what to expect if this were something that came up in your care. But the idea is that we go to the operating room. We decide to do the treatment. We go to the operating room. The patient goes under general anesthesia. I then use a lot of different tools to get the laser in the exact right point. And just as a brief historical digression, this sort of treatment was in vogue for a while, but the problem was that we couldn't measure the temperature in a way that was precise enough. So you obviously, like a lot of these treatments that we're using, want to injure certain tissue, the cancer and the tumor, and to preserve the normal tissue around it. In some of the old technologies, you could measure temperature on the tip of the catheter. But the fundamental technology, which you're about to see a couple of videos of, is actually an MRI technology. And some physicists figured out how to use an MRI machine to measure temperature. So after I put the catheter in place, there's really no incision. The incision is about 1 millimeter in length, just where the catheter goes through the skin. We then transport the patient to the MRI machine, and the treatment is done within the MRI machine. And again, the cool part that I just mentioned, and I'm going to try to really, like, if there's one thing you take away from this from a technology perspective, this is it, is every 2 seconds we are measuring the temperature in every voxel of the MRI. So I'll show you what I mean by that. So here's a video. And before I get started, this is a patient who had, I forget what the primary cancer was. I believe it was lung cancer to the left parietal area. And so that you see here is the white area, and the black line is the catheter that I've put into place. And so this is how it looks right when we get into the MRI machine. And here, this is a little artifact. It looks a bit psychedelic. But you'll see as we start the treatment, a heat map is generated, and that's what I'm watching carefully, if I go back, on this screen. And there's a lot of different parameters and temperature and time, among many other things that I'm controlling. But I'm going to start the movie now. And so what you see is, first I do a little test dose just to make sure I'm in the right spot, and now I turn the catheter on. Here's the laser power shown here, and on your right side, you're seeing the sort of cumulative damage, cumulative ablation or burn to the tumor area. And I'm then gently withdrawing the catheter along that, withdrawing the laser along the line of the catheter. And so then you end up, I don't know if it shows it at the end, it probably doesn't. I guess the video is on repeat with, again, a pretty good conformality of where the abnormal brain tissue is and where we heated up the tissue to the correct level to cause an injury. That makes sense? Okay. Just because I think it really illustrates the treatment well, I have another example of that. This is a patient who had multifocal glioblastoma. And I had removed her large, sort of the tumor she had presented with, which was relatively large. And this was a separate area that had grown despite radiation and chemotherapy. As I give a little test dose, make sure I'm in the right spot, and then I heat tissue. It's essentially an integration over time of temperature that we use to estimate how much injury is being done to the area around the catheter at various lengths around the catheter. But again, that orange is the area that we think is irreparably damaged, and that is conforming well to the area that's white where the tissue is abnormal. So this was that, I guess I didn't show this scan, but this is a sort of scan of a patient over time who received the treatment. And these first two were this was the patient that I had shown before. With that, let me go back. This is the 55-year-old man who had the weakness on the right side and had had previous treatments, and then ended up undergoing LIT therapy, or laser interstitial thermal ablation. This was his initial scan. This is what we saw before. These two images show what the scan looked like 2 days later. And then these two images show what it looked like a year later. And one of the things you can see is actually not the tumor itself, but the white around it is representative of edema or swelling. And that probably played a big role in creating the weakness on the other side of his body. And by burning the tumor, that white went away and his weakness improved. So just a brief slide in terms of if someone were, very high level overview, if somebody were considering this treatment, what should they expect? Well, you obviously need a preoperative MRI. It's really important to get a crisp, fine cut MRI because that's what we're using to place the catheter in the correct spot. The surgery typically takes 3 or 4 hours. And that's because, there's a fair amount to be done. We have to put the catheter in the right place in the operating room and then go to the MRI. So although it's 3 or 4 hours of surgery, it's actually the same amount of blood loss that you would, have if you just sort of had some routine labs drawn. This is actually probably less than you would get if you had routine labs drawn. Patients often go home the next day. That said, it's not uncommon to go home the second or the third day. And, the sort of return to your normal self, there's anytime you treat something surgically in the brain, there can be irritation and actually a slight worsening of symptoms briefly. But between recovering from the actual surgery within the brain and then just the effects of general anesthesia and being in the hospital, a week or two later, people are typically if they were taking long walks before, they're taking long walks again.